You see that in this world now, 42 million people suffer from diabetes. And this unfortunate community is low and middle income countries. And out of this 122 million, 1.6 million deaths are directly attributed to this diabetes. And more than 60% of these diabetes patients are from this Asia. And the diabetes prevalence is escalated to 20.8% in adults, affecting 20.8 million individuals in Malaysia. And it is estimated that in Malaysia it will rise 31% by 2025. Now, these huge numbers actually contribute up to 2 billion ringgit of government annual healthcare expenditure. And the severity of this diabetic neuropathy goes to amputation of leg. And this amputation cost itself for Malaysia is around 40 million ringgit per year. Now, to avoid this costing or to to diagnose this severity, there are several kinds of methods. For example, nerve conduction studies, quantitative sensory testing, invasive EMG, and so on. But the problem is that for most of these diagnosis methods, they require grading by the healthcare professionals. And most these early detection techniques require extensive offline analysis and also require expensive and specialized equipment. But the research that we have completed is called the Adaptive Neuropathy Inference System for DSP severity classification by investigating electromyography patterns during gait of diabetic patients, where severity will be classified into 4 different stages. That is highly severe, mildly severe, severe, and good. And from this diagnosis method, we don't require any extensive offline analysis. We don't require any expensive and specialized equipment. And not only that, it is non-invasive. And therefore, this diabetic sensorimotor polyneuropathy severity classification will help for early diagnosis of diabetes neuropathy and treatment to prevent foot ulceration, amputation, and other diabetic-related complications. The consumers direct consumers, obviously the diabetic patients. Not only diabetic patients, also the healthy patients. Healthy patients, they need to know that when they are actually affected by diabetics, right? Obviously, when you have diabetics, straight away you are not getting the polyneuropathy problem, right? But eventually you will get. So if you have these tools handy, that means you can monitor that what's going on, whether you are developing this one or not. So this is for the general public. And those who have already suffering, they know the severity, which stages he is having now. And obviously, when I'm telling diabetic patient and the normal, human being, so obviously it goes to the healthcare institution as well, like doctor's clinic, hospital, and as well as the government itself.